Right, we start with questions. Secretary of State for Health and Social Care, Jack Rankin.
Question number 1, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. We expect all women to be shown the utmost care and respect when receiving maternity and neonatal care. This year's planning guidance requires ICBs and providers to deliver the key actions in this final year of NHS England's 3-year delivery plan. But from listening to the harrowing stories of bereaved and harmed families, it's clear we must do more. Secretary of State is urgently considering the significant action needed to ensure that all women and babies receive the care they deserve.
Jack Rankin.
Thank you, Mr. Speaker. Last year's birth trauma inquiry report exposed that maternity services in this country are woefully underfunded. Now the Health Secretary intends to cut the budget for maternity improvements from 95 million to just 2 million. That equates to under £4 per child born in this country per year. What kind of change is that? What message does this send to mothers across this country, and does he plan to implement any of the birth trauma inquiry's report recommendations, many of which were committed to by the previous government?
Minister.
What did you do?
The honourable gentleman is not correct. Maternity funding is not ring-fenced in the same level. I think that's what he's referring to, but it's absolutely being committed to as far as ICB allocations, and local leaders will decide how best to allocate that money. And we will continue to work with Donna Ockenden and the families of previous incidents and make sure that the recommendations of her report and the maternity review is fully implemented.
Jen Craft.
Mr. Speaker. As colleagues will be aware, one of the key consistencies across failings in maternity units is a failure to listen to women and to put their experiences and quite often their pain during childbirth at the heart of driving improvement. So what assurances can the Minister give that women's experiences and voices will be at the heart of any maternity improvement strategy that the Government focuses on?
Minister.
She's absolutely right to highlight, and that's been found out in all the reviews that have been undertaken. It's completely unacceptable. That's why my honourable friend, the Right Honourable friend, the Secretary of State, has continued to meet with families and hear those experiences to make sure that we learn from those, that we continue to support the implementation of those reviews, and crucially we make sure that women's voices are taken forward as part of our 10-year plan.
So, Secretary of State Argar.
Thank you, Mr. Speaker. I fear many will have found the Minister's answer to my honourable friend disappointing. He highlighted that the last government committed to the headline recommendation of the cross-party birth trauma inquiry led by the Honourable Member for Canterbury and by the former Member for Stafford, Theo Clark, who's recently written about her experiences in a book and in the Mail calling for a national maternity improvement strategy. No equivalent commitment has been made by this government. So can we try again? And will the Minister commit without any equivocation to implementing the recommendation of the inquiry to produce a national maternity improvement strategy?
Minister.
To be clear to the Shadow Secretary of State, that my Right Honourable friend, the Secretary of State, is continuing to look at all of those and consider how best to respond.
Right, we come to Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker. Too many families in Shropshire have suffered the agonising loss of losing a baby following the scandal at Shrewsbury and Telford Hospital Trust. And with the CQC rating 65% of trusts as inadequate or requiring improvement for maternity safety, and the taxpayer forking out a staggering £1.15 billion in compensation for maternity failings last year, can the Secretary of State or the Minister describe how she can reassure us that with the £100 million that was put aside particularly to deal with unsafe staffing, with it no longer being ring-fenced, can she assure us that those safe staffing levels will remain in our maternity wards?
Minister.
Well, I know this is an issue that the spokesperson for Liberal Democrats follows very closely in her own local community. We are absolutely committed, as I think she knows and understands, to making sure that the recommendations of the reviews are fully implemented as part of that 3-year plan. But can I just gently say to the Honourable Lady that her party has consistently opposed the extra £26 billion that this government raised to support the wider health service. Without that extra funding and the decisions that the Chancellor made, we would not be able to make the progress that we are now starting to see.
Jessica Toale.
Question number 2, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. And despite my best efforts, can I welcome the member for Runcorn and Helsby to her place? Being a Member of Parliament is a privilege, and I know how special it is to sit on these benches, having been sent here by constituents, and regardless of political differences, wish her well personally. Mr. Speaker, with permission, I'd like to take questions 2 and 14 together. Mr. Speaker, as part of our 10-year plan for health, we want to deliver a real shift in the centre of gravity in the NHS so that people get more care closer to home, indeed in their home too. The NHS has much a neighbourhood health service as a national health service. We've already made progress in shifting care to the community, £889 million more in funding for GPs, agreeing the GP contract for the first time since the pandemic, and recruiting over 1,500 GPs onto the front line. Our 10-year plan will set out how we will continue to transform the NHS into a neighbourhood health service.
Thank you, Mr. Speaker. I'm deeply concerned about the quality of healthcare for people experiencing homelessness in my constituency, Bournemouth West. Health Bus, a local charity, is doing great work to get out into the community, to treat people where they are and prevent them from getting into hospitals. But they are not getting the funding they need and have discovered serious discrepancies in the way the local ICB commissions services, particularly for health inequalities. So can the Secretary of State tell me how this government is prioritising health outcomes for people experiencing homelessness, and will he meet with me and Health Bus to discuss how we can support their important work?
Secretary of State.
Mr. Speaker, it was the founding mission of the NHS to always be there for people when they need it, so that whenever they fall ill, they never have to worry about the bill. And unfortunately, too many people in our country today experience that fear that Nye Bevan sought to eradicate, thanks to the disaster and the failures of 14 years of Conservative government. As my honourable friend would expect, tackling health inequalities for homeless people and other vulnerable groups is absolutely central to the values of this Labour government, and those values will be reflected in our 10-year plan for health, and I'd be delighted to hear further from her on what we can do to improve services in her area.
Joe Platt.
Thank you, Mr. Speaker. And I want to thank the Minister for his announcement this morning regarding GP services. And one way pressure is eased in our GP services is through organisations like Compassion in Action. It's a charity in my constituency that provides non-clinical whole-person care. So they receive GP referrals across Leigh and align with the government's aim to shift care from hospitals to communities. So will the Minister join me in thanking the staff and founder Pam Gilligan and agree to come for a tour to see the facilities and to see firsthand the impact that they have?
Thank you, Mr. Speaker. I wholeheartedly join her in thanking Pam and everyone at Compassion in Action for the work that they do. I think at the heart of this government's approach to health is a recognition that government action is essential for improving health outcomes in our country, but government acting alone will not be sufficient. That's why working with the voluntary sector, working with employers, working with trade unions, community groups, and actually all of us as individual citizens is vital for tackling health inequalities and improving care in our country. And I'd be delighted to make sure that one of the team comes to visit as soon as we possibly can.
Stuart Anderson, welcome back.
Thank you, Mr. Speaker. Community hospitals can reduce pressure on major hospitals, especially in rural communities like mine. Will the Secretary of State lay out his plans of how he intends to support community hospitals in South Shropshire?
Well, Mr. Speaker, at the heart of this government's approach is investment and reform of the NHS to make sure we deliver better outcomes for patients. That means the biggest devolution of power in the history of the NHS, with more decisions taken closer to patients and their communities, indeed more power in the hands of patients too. Community hospitals do have a vital role to play, and no doubt, thanks to the decisions taken by this government to deliver £26 billion more into our NHS, we'll be able to make further and faster progress, opposed by the party opposite.
Susan Berry.
Thank you very much, Mr. Speaker. In my constituency of Mid and Bartonshire, there's an ageing population in need of local healthcare services. Will the Secretary of State meet with their Scottish counterpart to discuss the need for increased access to community healthcare, specifically the need for a new health and care centre within my constituency of Mid and Bartonshire? Thank you.
I'm grateful to the honourable member for her question. She'd be delighted to know that only last week I met with my counterparts in Scotland, Wales and Northern Ireland to talk about how we can work together to improve health and care throughout the United Kingdom of Great Britain and Northern Ireland. She will know that health is devolved, but thanks to the decisions taken by this Labour government, the Scottish Government has just been delivered the biggest financial settlement since devolution began, which might mean they might finally make some progress on their waiting list, where 1 in 6 Scots are on a waiting list, and the SNP are onto their 5th NHS reform plan in 4 years.
It's coming down. Alex Bellinger.
Question number 3, Mr Speaker.
Minister.
Thank you very much, Mr Speaker. I'm very pleased to tell my honourable friend that we've recruited over 1,500 additional GPs since October through an investment of £82 million, helping to fix the front door to the NHS. And today we've announced £100 million of funding that will unlock new capacity and more appointments in GP surgeries, and we've also launched a red tape challenge and scrapped unnecessary targets in our new GP contract to cut down on bureaucracy and free up time to spend with patients.
Speaker, my constituents in Hale Zone have written to me time and again complaining that they are calling at 8 a.m. Their GP surgeries as instructed, but they are still unable to get a same-day appointment. So can the Minister set out for my constituents how this £100 million investment in GP surgeries, consulting rooms and other facilities will finally put an end to this frustrating 8 a.m. scramble?
Minister.
Well, I thank him and absolutely share his frustrations and the frustrations of his constituents. The investment that we've made today was in response to GPs telling us that they needed more space, leading to more capacity, leading to better access and better outcomes for his constituents. Of course, today's announcement was only possible thanks to the decisions made in the October budget, which were opposed by every party opposite. So the choice is clear: investment in our NHS with Labour or cuts with the Tories and reform.
Rebecca Smyth.
Thank you, Mr Speaker. My constituent, Dr Toby Nelson, an NHS consultant dermatologist, has started a business that seeks to address the heavy demand on primary care for skin health screening. His business, Map My Mole, sends an image capture kit to patients to attach to their smartphones. The patients then send the high-resolution image remotely to be reviewed by a specialist consultant, bypassing the need for a GP appointment and freeing up time and resources for both doctor and patient. It's already resulted in a significant drop in skin cancer referrals in pilot GP surgeries. So will the Minister agree to meet with Dr Nelson and I to discuss this revolutionary proposal?
I thank the Honourable Lady for that question. She raises what sounds like an extremely interesting scheme. She will know that we've got a strong commitment in our 10-year plan to shifting from hospital to community and indeed from analogue to digital, and the digital aspects of what she just said sound very interesting, so I'd certainly be more than happy to take further representations from her.
Number 4, Mr Speaker.
Minister.
Thank you, and I thank my honourable friend for that question. She is an outstanding campaigner on this issue, as I'm sure everybody across this House is aware. She will know that the NHS England Accelerator pilots have shown how improved IT connectivity and a single point of access can speed up eye care referrals and allow more patients to be managed in the community. It's a great example of that shift from analogue to digital that we want to make. We're developing the 10-year health plan with input from the public, from our partners and health staff, and which of course includes the eye care sector.
Thank you, Mr Speaker, and I thank the Minister for his response. And can I say I welcome all the work both he and the Secretary of State are doing in rebuilding our NHS. But we know that there is a capacity crisis within eye healthcare. NH ophthalmology continues to be the busiest and largest outpatient service. And we know that essentially what's leading to many people are ending up not getting seen soon enough, and which is resulting in many of them losing their sight unnecessarily. So what we need is a joined-up healthcare plan. So will the Minister agree to ensuring that eye healthcare will be part of the government's wider 10-year health plan?
Well, I thank her for that question, and she's absolutely right that early intervention is crucial. The interface between the high street and secondary care is a vitally important part of that, and that means having a joined-up eye health strategy. The 10-year plan will absolutely have that joined-up strategy at its heart. She'll be pleased to know that since July, ophthalmology waiting lists have dropped by 24,000. So change has begun. There's still a long way to go to dig us out of the mess left by the party opposite, but it's thanks to the decisions this government's made, opposed by parties opposite, that we're beginning to see that change gaining traction.
So James, lovely.
Thank you, Mr. Speaker. Another part of the 10-year health plan is the use of digital technology. AI auto-contouring reduces waiting times, frees up capacity for radiotherapists, which is why, under the Conservative government, £15.5 million was allocated, money which has now been cut under his government. Why?
Minister.
I think the Honourable Gentleman's referring to the single point of access digital technology, which is game-changing in terms of improving the interface between high street and secondary care, as the question's about eye care. So I probably just worth reminding him of that. We are absolutely committed to single point of access technology. We believe it can be game-changing technology, and it's a vitally important part of our shift from analogue to digital.
Dr. Peter Prince.
Thank you, Mr. Speaker. The President of the Royal College of Ophthalmologists has stated that the widespread outsourcing of NHS cataract surgery to private for-profit providers risks the integrity of hospital eye surgery departments, meaning that there will be few services to treat patients with preventable blindness. So how can we reassure the public that such services will be maintained?
Minister.
Well, I thank him for that question. And whilst the independent sector clearly has an important role to play in tackling waiting lists and backlogs, we will not tolerate any overpriced or subpar care, and we will not tolerate any distortion of patient choice. The recently published partnership agreement between NHS England and the Independent Healthcare Providers Network commits to ending incentives that can lead to this, supporting equal access and genuine choice for all patients, and we're working together to deliver on this.
Yes, Bramford.
Mr. Speaker, NHS Sussex ICB is one of only 5 in England not to commission a minor eye condition service known as MECS in community optometry settings. This means that patients in Chichester with urgent or minor eye issues have to either join the 8 a.m. queue for a GP appointment or go to their hospital rather than being seen quickly on the high street. Given that 99.9% of MECS patients elsewhere in England are seen within 24 hours, will the Minister set out what action he is taking to ensure that MECS are commissioned consistently across all ICBs within the 10-year health plan?
Minister.
Well, I thank her for that question, and of course ICBs are responsible for doing the commissioning of these services, which are clearly extremely important, and the early intervention side of eye care is particularly important. So I'd be more than happy to look into that issue with her particular ICB if she would care perhaps to write to me and make further representations.
Blake Stevenson.
Question number 5, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Our mission-driven approach to this issue means that we are working with all departments to deliver an NHS fit for the future, and we expect integrated care boards to work closely with their mayors to maximise public health and contribute to the government's health and growth missions.
Blake Stevenson.
I thank the Minister for her response. Funding and delivery of a GP surgery for Wixham's in my constituency continues to fall between the cracks of developers, local councils and the local ICB. Does the Minister agree that to break these kinds of deadlocks and build the infrastructure our communities require, new mayors should have the power to direct ICBs, making locally elected politicians responsible rather than unelected quangos?
Minister.
He tempts me slightly on the local accountability issue, which he may know. I know he has been a strong campaigner on this issue, and he knows, because I've met with him, that I do agree that it is important that these local bodies respond properly to making sure that where there are expansions of housing, which we want to see, that they are supported by local infrastructure. I'm happy to come back to him again if there's any more detail that I can provide to him.
Alice MacDonald.
Thank you very much. Norfolk and Waveney ICB is consulting once again on closing Norwich's walk-in centre. They asked the same question 2 years ago, and the city and Norfolk said, no, we want to save our walk-in centre. So does the Minister agree on the importance of walk-in centres, and how we will ensure in the context of devolution that ICBs actually heed what residents are saying?
Minister.
She's absolutely right to be campaigning on behalf of our local constituents to make sure, as we want to see, that more services are delivered in communities. We want to see services out of hospital into local communities. It is up to the ICB to decide how they're commissioned, but we will certainly be making sure as part of our 10-year plan that we see more of these sorts of services working together in neighbourhoods as part of our commitment.
Natasha Irons.
Question number 6, please, Mr. Speaker.
So stay.
Thank you, Mr. Speaker. People deserve the very best health and care. Our plan for change is already bringing waiting lists down. Our 10-year plan for health will set out how we improve access and make the 3 shifts I described earlier so that the NHS is fit for the future. At the same time, we're rebuilding adult social care now and for the future. Baroness Casey's independent commission has launched, and it will set out through its work how we will create a national care service. All of this made possible thanks to the investment decisions taken by the Chancellor in her budget, investment opposed by the party opposite, showing that you can only trust Labour to invest in and modernise our NHS.
Natasha Irons.
Thank you, Mr. Speaker. Last week, the Centre for Young Lives published a report looking at the state of mental health support for children and young people across England. The report outlines that despite ongoing crisis in mental health amongst young people, there remains a 55% treatment gap between adult and children's mental health, and fewer than 10% of integrated care boards have a dedicated strategy to support children's mental health. So will he consider strengthening statutory guidance for ICBs to ensure they assess the local need of children and young people, publish their treatment gap data on an ongoing basis, and create joined-up, community-based mental health support for our young people?
I'm grateful to my honourable friend for her question. Young people's mental health is a priority for this government. That's why we set out in our manifesto our commitment to make sure mental health support is available in every primary and secondary school in the country. We have walk-in mental health services in every community, and we also invest in the mental health workforce so that we can cut waiting times. I'm also working very closely with my right honourable friend, the Secretary of State for Education, to make sure that our education and health services are working closely together so that children get the very best start in life, and we're looking after mind, body, soul, aspiration and futures.
Sir Roberts.
Thank you, Mr. Speaker. The Chancellor increased the cost of employing people in social care by raising national insurance contributions for social care employers and then exempted NHS employers from those increased costs. When will this government properly support social care and relieve the sector from pressures caused by the Chancellor under this government?
Mr. Speaker, thanks to the decisions taken by this Chancellor, we're putting £26 billion more into health and social care. Thanks to the decisions taken by this Chancellor, the spending power of local authorities has risen. Thanks to the decisions taken by this Chancellor, we've delivered the biggest expansion of carers allowance since the 1970s. Thanks to the decisions taken by this Chancellor, we've significantly increased the disabled facilities grant, not just last year, but this year. That's the investment delivered by a Labour government, opposed by the Conservatives, and reform which shows you can only trust Labour with our NHS.
Oh, chance in a minute. Dr. Luke Evans.
This government has been in power for 10 months. 2 months ago, Labour postponed the cross-party talks on social care. Can you tell this House when they will be rescheduled?
Mr. Speaker, as I've announced to the House, the work of Baroness Casey's independent commission is up and running. She's making contact with parties across this House as part of the work of her commission, and it's for Baroness Casey to decide the base upon which she's engaging with parties, and I look forward to working with parties at the conclusion of the process.
Dr. Luke Evans.
Well, thank you for his change for it to be no longer cross-party, but the government has said that the full changes won't be implemented until 2036. Now, only this week, the Health and Social Care Committee released their new report on social care and the huge cost of inaction. The report called for new actions that could be taken now. They include things like publishing annual assessments of the level of unmet care needs for adults, as well as annual estimates into how much delayed discharges are costing the NHS. Will the Secretary of State commit to those two today?
Mr. Speaker, I do take the Select Committee seriously and I'll look carefully at their report. But the Shadow Minister has got some brass neck. He talks about this government being in for 10 months. They had more than 10 years and now we're picking up the pieces for the mess they left behind. That's why they were kicked out of government. That's why they're being kicked out of opposition. Looking at this lot must be how the islanders felt looking at the dodo.
Question number 7, Mr. Speaker.
Minister.
I thank the Honourable Lady for her question. We're already rolling out our manifesto commitment of 700,000 extra urgent dental appointments per year. These appointments are available across the country for those experiencing painful dental issues such as infections, abscesses or cracked or broken teeth. We are committed to reforming the dental contract and making NHS dentistry fit for the future.
Thank you, Mr. Speaker. The dental contract imposed in 2006 is widely recognised as a key factor driving dentists out of the NHS. In my constituency of Stratford-on-Avon, there are no NHS dentists currently taking on new patients, and existing NHS patients are being actively pressured to go private or seek care out of county. Will the Minister commit to urgent reform of NHS dentistry and set out a timeline of negotiations so that I can reassure my constituents?
Minister.
Well, I thank her for that, and she's right that the dental contract is fundamentally flawed and needs reform. I met with the British Dental Association on the 8th of April, had a very productive discussion with them about dental contract reform, and DHSC officials are now working hard with the BDA and other stakeholders to develop a dental contract that works for patients, dental professionals and for the public purse. I will, of course, keep her and the House updated. I know this issue is something of huge importance to the country and to every member of this House.
Chris Webb.
Mr. Speaker, it's been a year today that I was sworn into this House, but every single week someone has raised with me about getting access to a local NHS dentist in Blackpool. Nowhere is taking on adults, nowhere was looking after pregnant women. This has to change. So can the Minister outline to my constituents when they'll be able to get access to an NHS dentist under this Labour government?
Minister.
Well, I thank him for that, and there is no perfect payment system. We've got to look at the issue around units of dental activity, we've got to look at options around capitation, sessional payments, and come to a conclusion around what works in terms of ensuring that everything that we commit to NHS dentistry is spent on NHS dentistry, because we are in a mad situation now where demand for NHS dentistry is going through the roof, and yet we're having an underspend every year on the contract. So we've got to fix that. It's going to take some time to work that out with the British Dental Association, other key stakeholders. What is tragic about this situation is the party opposite had 14 years to fix this situation and left the situation in a terrible, terrible mess.
Mr. Speaker.
Minister.
Thank you. I commend my honourable friend for her work on such an important topic, and I know it's very personal to her. Specialist perinatal and maternity mental health services are available across England, providing vital support to parents before, during and after pregnancy, including increased access to evidence-based psychological therapies. We are training thousands more midwives to better support women throughout pregnancy, with mother and baby units and community services providing postnatal support.
Smyth.
I thank the Minister for her answer. Tomorrow is World Maternal Mental Health Day, recognising the particular challenges that some mums face in this period from pregnancy through to birth and after birth. I commend the Secretary of State and his team for their rapid work to get the NHS delivering better for patients again, as they develop the 10-year plan for the NHS. Can the Minister tell me more about what measures will be taken to ensure that all women, it's not this postcode lottery, but all women facing perinatal mental health challenges can access that right psychological support?
Well, I absolutely join with her in recognising the importance of supporting women's health throughout pregnancy and into parenthood on Maternal Mental Health Day. We are committed to improving the support available. It will form an important part of our 10-year plan. We're investing £126 million in family hubs and Start for Life services to support parents throughout pregnancy to early childhood, and we'll continue to work with her on this.
President Van Baalen.
Thank you, Mr. Speaker, and I thank the honourable member for her question and for the answer from the Minister. I'm delighted to be forming the all-party parliamentary group on fatherhood, and I'd also like the Minister to outline the steps she will be taking to improve perimental health for fathers as well.
Minister.
Well, I congratulate him on taking forward that work, and I know my friend, the Minister, will be very happy to continue to work with him on any way that we can to support the work. I think it's a really important aspect of parenthood.
Katie White.
Mr. Speaker, question number 9.
Minister.
Thank you, Mr. Speaker. We are already using technology to improve preventative healthcare and transform the NHS. We've invested £11 million in AI to trial breast cancer screening mammogram interpretation. We're piloting the NHS Health Check Online to tackle cardiovascular disease. And our NHS Better Health digital products, including the award-winning Couch to 5 app, were used by millions of people last year to tackle preventable conditions, and more will be included in the 10-year health plan.
Katie White.
Thank the Minister. Leeds is leading the way in health tech, with Leeds Teaching Hospitals, the City Council, NHS Digital and firms like EMIS headquartered in Rawdon in my constituency, driving real innovation. How will the Secretary of State and his team ensure that Leeds is at the heart of the NHS 10-year plan so we can shift to prevention and spread the benefits to every corner of the UK?
Minister.
Thank you. I commend the work that my honourable friend refers to. The new Health Tech Innovation Hub, a flagship project of the West Yorkshire Investment Zone, brings together West Yorkshire Combined Authority and organisations like the Health Tech Leeds Partnership, academics, clinicians, policymakers, more than 250 health tech firms headquartered in the region, and they are already driving forward health innovation together. And as we've said before, Mr. Speaker, we must learn about the best of the NHS and take it to the rest of the NHS. The 10-year plan will shift to a model where the NHS focuses on prevention, with more services delivered in local communities through new technologies.
Alex Brewer.
Thank you, Mr. Speaker. One piece of technology that already exists that can prevent hydrocephalus is the humble tape measure. The Secretary of State has said he would ask NICE to conduct a review into the frequency of infant head measurements to detect hydrocephalus early. The charity Harry's Hat, based in my constituency, says this review isn't necessary, the evidence is already there. Will the Minister meet with me and the charity to discuss this further so that more infants' lives can be saved?
And in fairness, the Secretary of State did meet with them.
And has just told me, Mr. Speaker, what a wonderful charity they are. And I'll be more than happy to make sure that the relevant Minister meets with the member to discuss that.
Gregory Stafford.
Number 10, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. As the Prime Minister and I announced, NHS England will be brought back into the department to put an end to the duplication, waste and inefficiency resulting from two organisations doing the same job. The final nail in the coffin of the disastrous 2012 reorganisation, which led to the longest waiting times, lowest patient satisfaction and most expensive NHS reorganisation in history. Since the announcement, we've set up a joint board, assessed resources and responsibilities across existing organisations, developed proposals on the role, functions and structure of the new centre and started detailed operational and legislative planning.
Stafford.
Thank you, Mr. Speaker. The Secretary of State claims to support change, yet delays to the NHS reorganisation, including to the promised abolition of NHS England, suggest otherwise. Isn't the truth, as the Secretary of State outlined in his Guardian article, that he's bogging the system down in a slow, top-heavy restructure, while instead resorting to tax rises instead of delivering the decentralised, locally delivered, value-for-money healthcare that our constituents deserve?
Secretary of State.
Yeah, a lot of words and not a lot of sense, Mr. Speaker. We are reforming the NHS and, as a result of these changes, redirecting hundreds of millions of pounds to the front line. And what is the Conservative Party's response to the abolition? The Shadow Chancellor of the Duchy of Lancaster said it could be a great thing, but it could be a total disaster. Will you let us know when they've made up their mind?
Anna Dixon.
Thank you, Mr. Speaker. I would like to just make the point that the Lansbury reforms, which were implemented top-down by the party opposite, the idea that the NHS could ever be truly independent when it is there to serve us, the taxpayer, the general public. So will the Secretary of State agree with me that it is absolutely the right decision to move funding away from the centre to the front line to prioritise patients in the work that the NHS does?
My honourable friend has huge experience in this area, and she is absolutely right. What we saw under the Conservatives was bloated bureaucracy, layer upon layer of checkers when we need more doers, and that is why frontline staff, patients and provider leaders all welcome the changes we are making so we can invest more into our frontline.
So, Secretary of State, and there you go.
Thank you, Mr. Speaker. The Health Service Journal reports officials have acknowledged that the first draft of a high-level plan for merging NHS England and DHSC has now been delayed. When asking any written question about the merger, the standard answer seems to be, and I quote, "Ministers and senior department officials will work with the new transformation team at the top of NHS England, led by Sir Jim Mackey, to determine the structure and requirements needed to support the creation of a new centre for health and care." Even when asking a question specifically about the size of that transformation team itself, the answer is virtually identical. Either they willfully decide not to answer or they simply don't know. As with so many things, the government goes for the headline-grabbing announcement and talks the talk on reform, but without having done the actual work to deliver it. So my question to the Secretary of State is simple. When will that first high-level plan for the merger, with full assessment of costs and savings, be published?
Mr. Speaker, honestly, he had his chance. He was the minister who took forward the last Reform Act of the last Conservative government, and he failed in that task. And now he turns up without a shred of remorse, without a shred of humility, attacking this government for cleaning up the mess they left behind. They're not a party of government. They're not even a party of opposition anymore. They are a total irrelevance.
Josh McAllister.
Question 11, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. We are committed to fixing the front door of the NHS, including delivering the primary care infrastructure required to enable a neighbourhood health service. We've already taken steps to improve primary care infrastructure, including £100 million capital funding to upgrade GP buildings. We will set out how we will move to a neighbourhood health service in our upcoming 10-year plan following the spending review.
Josh McAllister.
Thank the Minister for her answer to that question. Workington suffers from some really poor health outcomes and has an incredibly fragmented health system. I've worked with local leaders in my constituency to pull together a plan for a new neighbourhood health centre called the Workington Health Zone, based around multidisciplinary teams, clear goals and less bureaucracy, and much greater access for patients. Would the Minister agree with me that this is exactly the kind of reform that we need to be enabling through the forthcoming 10-year plan?
Minister.
Thank you, Mr. Speaker. I do agree with the honourable member, and I would be delighted to work with him on the government's commitment to deliver a neighbourhood health service which reinforces integrated working for the NHS, local government, social care and wider partners as the norm.
Mr. Backman.
Thank you, Mr. Speaker. Knutsford desperately needs a modern medical centre. The local GPs and the community are united that the current provision no longer is fit for purpose, and with the growing population, it cannot meet everybody's need. So in light of the government's announcement of £102 million to modernise GP surgeries to make it easier to see more patients, would the Minister meet with me to discuss a new modern medical centre for Knutsford?
Minister.
I thank the honourable member for recognising the significant investment announced today in GP services and buildings, and I'd be delighted to ensure that the relevant minister will meet with her.
Go Snell.
12, sir.
Minister.
Thank you, Mr. Speaker. Driving down waiting times is one of this government's top priorities, and my colleagues at NHS England continue to keep in regular contact with ICBs on improving those waiting times and delivering the ambitions in our elective reform plan. Since July, we've cut waiting lists by more than 219,000 across England and 6,000 in university hospitals in North Midlands, and delivered 3 million more appointments.
Thank you, Mr. Speaker, and I thank the Minister for her answer and recognise the Herculean effort the Department is making to reduce waiting times, particularly in Stoke-on-Trent. But one cancer patient who is having their treatment at the Royal Stoke Hospital in my constituency has shared her story with me. From the initial operation, it took 6 weeks for her to be told she may have cancerous cells in the lymph node. There was a delay in the CT scan, and then after the CT scan, she was told it was 10 weeks to meet an oncologist to discuss the results. So could the Minister say a bit more about how, whilst reducing
access to the waiting times into the service, once someone's in a treatment plan, how is the department making sure that treatment is given in a timely fashion?
Minister.
Well, I am sorry for the experience that his constituent has had, and he highlights a really important aspect of the patient journey through the system, and I want him and the House to be absolutely assured that we are looking at that entire patient journey, both into hospitals and between hospitals. We are determined to improve patient experience and the quality of their care and get back that patient satisfaction that was squandered by the last government.
Honourable Jordan.
Team, Mr. Speaker.
Secretary.
Thank you, Mr. Speaker. Reducing hospital backlogs is a key priority for this government's plan for change, as the 18-week standard for elective care has not been met for almost a decade. Our elective reform plan sets out how we return to this standard by the end of this Parliament through a combination of investment and reform. Since July, the waiting list has reduced by over 219,000, and we have delivered an extra 3 million appointments, exceeding our manifesto pledge and doing it earlier than planned.
Yogi.
I'm grateful to the Secretary for his answer and for the progress made, but there is still more to do. My constituent in Newcastle-Lyme has recently been recovering from brain surgery at the Royal Stoke University Hospital. However, she's faced multiple setbacks due to failures in duty of care, including scalding injuries and a severely mishandled admission process. She's now receiving the correct care but had to wait many months to be admitted to the correct ward and has been given limited time for rehabilitative treatment. So does the Secretary agree with me that to tackle backlogs, our hospitals must have the resources they need to provide the right care the first time round, and that patients are given the time and support to fully and effectively recover?
Mr. Speaker, I'm grateful to my honourable friend for his question and horrified to hear about his constituents' experience. This is a government that will never brush problems under the carpet, that will never pretend that things are better than they are, and I know that for all the progress we've made in the last 10 months, there is still so much more to do. And when we publish our 10-year plan for health, we've got to make sure that quality and safety are at the heart of every patient interaction. He's right about the need for investment. That's why we're investing £26 billion in the NHS and social care, and why it's so disappointing that the parties opposite voted against it.
Mira Hobhouse.
On a recent visit to the Royal United Hospital in Bath's breast unit, specialists told me about a red flag system which could help speed up care. If someone has a red flag symptom, like a lump or bleeding nipple, the triage team could book them straight into the breast clinic rather than waiting to see a GP. Would the Secretary of State support an approach like that?
Can I thank the honourable member for an extremely constructive contribution? That is exactly why, at the heart of our plans for reform and modernisation, we're also placing such an emphasis on the digital and technological transformation. We have such rich data about our patients' experiences that we're not using effectively enough. If we use the information more effectively and efficiently, we can spot and identify risk much more proactively and make sure that people get timely access to urgent care and treatment when they need it.
Dr. Britton.
Thank you, Mr. Speaker, and I'm also grateful to the Secretary of State for the work he and his team have done to reduce NHS waiting times month on month for the last 6 months. However, the backlog that grew under the last Conservative government is still impacting my constituents, and I've listened to countless constituents who've told me about the upsetting impact of long waiting times for an ADHD diagnosis for children. This is having a detrimental knock-on impact on access to support, including to CAM services, shared care agreements and lack of support for adopted children. I welcome the news that the waiting lists have gone down, but can the Minister set out how his work will be targeted to bring down waiting lists for an ADHD diagnosis in my constituency to ensure consistency in diagnosis rates across trusts?
I'm so grateful to my honourable friend for her question, and I pay tribute to my right honourable friend, the Secretary of State for Education, who's leading work cross-government in this area. We have a task force specifically looking at the issues that she raises, and together we're looking to make sure that our education and our health services are better joined up to meet the needs of young people. I'm also working with my honourable friend, the member for Whitehaven and Workington, to look at how, drawing on his experience, how we can improve the health and care of care-experienced young people and young adults. So I hope we'll have lots of progress to report on these issues.
Leigh Anders.
Thank you, Mr. Speaker. Of course, one of the ways to reduce the backlogs is to reduce or put an end to health tourism. in this country where people come to this country, get the treatment and then nip back to where they come from. So does the Secretary of State think it's a good idea that people entering this country should provide health insurance or be refused entry?
Mr. Speaker, when any of us travel abroad, we expect to take out travel insurance and pay for our healthcare needs overseas. And that is the standard we expect for visitors to our country too. We've got lots more to do to improve on that front. Can I also say that I deplore the comments made by his party leader, who said he does not support a taxpayer-funded NHS for the British people. He might want that debate. The leader of the so-called opposition says she wants that debate. As far as Labour's concerned, we're clear about where we stand. This will always be, under Labour, a national health service, publicly funded and free at the point of use.
Question 15. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. This government is taking a hard-headed approach to cutting waiting times. We're investing an extra £26 billion in our NHS, and where the independent sector has spare capacity, we will pay to get NHS patients treated faster, free at the point of use. So far, our approach to investment and reform has cut waiting lists by over 200,000. Perhaps the honourable member will tell us how it's going in Scotland.
Thank you, Mr. Speaker. The Secretary of State claimed this morning on BBC Radio 4 Today programme, and a most excellent programme it is, that the Labour Party are the only party that can be trusted with the National Health Service. So can he confirm that no aspect of the NHS whatsoever, whether ownership of the estate, provision of specialist services or any other form of privatisation, will be included in the much-promised trade deal between the UK and the United States? No more excuses, Secretary of State. Just give a direct answer to a direct question.
Mr. Speaker, I've said it before and I'll say it again. The NHS will be privatised over my dead body. This party founded the NHS as a publicly funded public service, free at the point of use. We do use the independent sector to cut waiting lists. And guess what? The SNP-led government in Scotland does the same thing. We've also made it clear that the NHS is not up for sale in any trade deal. It is clear, it is unequivocal. He can sling mud as much as he likes. What he can't do is run from the SNP's abysmal record on the NHS of 18 long, poor years.
Right, let us come to topicals. Yuan Yang.
Question number 1, Mr. Speaker.
Stay.
Straight to Thank you, Mr. Speaker. GPs are at the front door to our NHS. Today, I can announce that we are supporting over 1,000 surgeries across the country to modernise their buildings, backed by over £102 million, the biggest public investment in GP facilities for 5 years. Following years of neglect, this vital funding will create additional space to see more patients, boost productivity, improve patient care, and will enable 8 million more family doctor appointments each year.
Thank you, Mr. Speaker. I very much welcome today's announcement of refurbishing 1,000 GP surgeries across the country, because I've made it my own priority to meet with as many GPs as possible in my own constituency of Earley and Woodley. Our local GPs have been telling me that our health centres need more physical space in order to accommodate growing local needs, as well as to facilitate the expansion of healthcare into the community. So would the Secretary of State be willing to meet with me and my local GPs to discuss how we can better improve the physical space needed for care to be brought close to people's homes?
Thank you, Mr. Speaker. I'd be delighted to do so. Since we came into government, we made this announcement today. We put £889 million into general practice. We've agreed a contract with GPs, including reform for patient access and services. We are fixing the front door to the NHS. Of course, it will take time. We've recruited 1,500 more GPs by the end of March, but day by day, week by week, month by month and year by year, people should see improvements in their GP services thanks to Labour.
Shadow Minister Dr Caroline Jones.
Thank you, Mr. Speaker. Mr. Speaker, taking medicines on time is important, especially for conditions such as diabetes and epilepsy. Dr Atherton, an A&E consultant who has time-critical medicines for his own Parkinson's disease, understands this well. He's been running a quality improvement programme to ensure time-critical medicines are given on time in A&E. Will the Secretary of State lend this project his support, and will he commit to reviewing how time-critical medicines are delivered on wards as well?
Mr Speaker, I thank the Shadow Minister for her constructive question. I'd be delighted to hear more about this particular initiative. She's absolutely right about timely access to medicines, and I think through a combination of service reform but also modernisation of technology, we can assist clinicians and patients to help them manage their medication and make sure people get timely access to medicines.
Dr. Caroline Jones.
Thank you, Mr Speaker, and I thank the Secretary of State for the answer. I'd be delighted to meet with him to discuss it further. Mr Speaker, unfortunately, when Labour negotiates, Britain loses, and this government capitulated to union demands with nothing in return. It is therefore of no surprise to anyone that within months they're back in dispute with resident doctors and that the BMA have announced a ballot for strike action. So what is the Secretary of State going to do to protect patients and taxpayers?
Mr Speaker, I'll tell you what we're not going to do. We're not going to see £1.7 billion wasted on resident doctor strikes. We're not going to see £1.5 million cancelled operations and appointments. That's exactly what happened on their watch. Within 3 weeks, we ended the resident doctor strikes and we've cut waiting lists by 200,000 as a result. As I've said to resident doctors, they will see their pay offer is fair and that neither staff nor patients want to go back to the bad old days of strikes under the Tories. They had an unwilling and incalcitrant government under the Conservatives, unwilling to work with resident doctors. We want to work with them to deliver better care for patients.
Mr Richard Quidley.
Thank you, Mr Speaker. I would like to pay tribute to my 17-year-old constituent, Arlo Lamley, who tragically died on April the 13th following a diagnosis of a grade 4 brain tumour. I knew Arlo. He was a fun and bright lad and will be sadly missed. Whilst Arlo's parents, Ellie and Alex, wish to put on record their thanks for the, in their words, incredible and compassionate care Arlo received at St Mary's Hospital on the Isle of Wight, they want to know what steps the Secretary of State is taking to improve NHS access to breakthrough treatments, ensuring that the commercial interests of pharmaceutical companies do not take precedence so that children like Arlo are given the best possible chance of surviving longer from brain cancer.
Minister.
Thank you, Mr Speaker, and I'd like to add my condolences and heartfelt condolences to Arlo's family. In September, we launched a new series of funding opportunities designed to help increase brain cancer research for both adults and children, and we're committed to furthering our investment and support for high-quality brain tumour research, ensuring funding is used in the most meaningful and impactful way. Honourable members will note that there is a debate due on Thursday on brain tumours, and I'll also be attending the APPG on brain tumours next week.
Helen Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr Speaker. When he gave his statement to the House just after Christmas, the Secretary of State acknowledged that cross-party consensus is essential to delivering meaningful social care reform, and Liberal Democrats support him in that endeavour. But we still don't have a date for those cross-party meetings. Will he give us one now?
Mr Speaker, dates for meetings with the Commission are now a matter for the Independent Commission.
Josh McAllister.
Thank you, Mr Speaker. West Cumbria, like many parts of the UK, is a dental desert, and in some communities, urgent dental access centres have proven a real success at building up dental services. So will the Minister join with me in supporting my campaign to introduce an urgent dental access centre in West Cumbria?
I thank him. The government has, of course, launched the 700,000 urgent dental appointments. I think there's 57,500 allocated to his ICB. He will know, of course, that ICBs are responsible for commissioning primary care services based on the needs of the population. But I also know that he is a very strong campaigner for his constituents. I understand that his dialogue with his ICB on this matter has been positive and constructive, and I'm sure that he will continue to fly the flag.
Sir Jeremy Hunt.
The Chief Executive of the Royal College of Midwives said that the axing of the maternity safety ring-fenced pot would, she said, be a wrecking ball to the efforts being made to improve maternity safety. Just a single or a small group of babies spared lifelong disability will more than pay for the cost of this many times over. I know the Secretary of State cares about this deeply, so will he reconsider?
Mr Speaker, the funding is still there, but as many people have urged me, including the right honourable gentleman, we are taking the decision to give more freedom and more flexibility to independent care boards and systems and providers to determine how they can best spend NHS resources on services to improve patient care, safety and outcomes. I think everyone will know that maternity safety is understandably a priority for this government, and of course we expect and will hold the NHS to account to deliver on maternity safety standards.
The view, Ben.
Thank you, Mr. Speaker. Residents in Thiel and across my constituency tell me time and time again how hard it is to get a GP appointment, causing distress and sometimes dangerous delays. Can the Secretary of State outline how his programme of reform and investment will end the 8 a.m. scramble for good and deliver more GP appointments for my constituents?
Minister.
I thank her. Well, she will know that we've hired 1,500 more GPs. That's going to help with access. We've also renegotiated the contract so there will be online booking systems in every practice in the country, and we've changed the contract to incentivise continuity of care in order to bring back the family doctor. So there's a suite of reforms coupled with investment. I hope that that will deliver for her constituents.
Bob Blackman.
Thank you, Speaker. One of the great frustrations for medical professionals and patients alike is those patients that have appointments but don't turn up. So what action is the Secretary of State going to take to make sure that actually people that miss appointments are penalised in the system, and so that patients can actually get the treatment they need when they need it?
Thank you, Mr. Speaker. We're absolutely convinced that better use of digital tools will enable us to reduce significantly the number of missed appointments and also build in and factor in the likelihood of no-show so that we can reduce waste, eliminate inefficiency. I understand the case he's making for penalties. That's not a route we want to go down until we've made these improvements, and we'll judge how effective they've been then.
Jim Dixon.
Thank you, Mr. Speaker. Far too many promises made by the last government that care would move out of hospitals and into the community have turned out to be hollow. I know from speaking to residents in Dartford that hospital and community services have struggled to keep pace with new housing developments in the constituency. In Dartford later this year, I'm pleased to say we're going to see an expansion of our state-of-the-art community diagnostic centre taking care closer to where people live in Dartford. Would the Minister agree with me that this is the start of Labour getting on with finally delivering this big shift? And will he visit Dartford with me to see the centre?
Order, Jim. Come on, I think he got the message in the first stage. If he didn't know it, I'm surprised. Come on, who's answering?
Mr. Speaker, he is absolutely right, though, that this is exactly the sort of thing that we are seeing being rolled out across the country and committed to delivering care closer to where his residents live.
Blake Stevenson.
Residents in mid-Bedfordshire are concerned about the standards of maintenance at our two local hospitals. What action is the government taking to support our hospitals in Luton and Bedford catch up on maintenance backlogs?
Thanks to the investment the Chancellor committed to, we are investing in the sorry state of the NHS estate. I'm afraid that is an investment the honourable gentleman voted for, and his constituents be fuming when they find out who was responsible.
Thank you, Mr. Speaker. Recently I heard from Chelsea, a constituent of mine, who raised concerns over her grandmother Anna's care. After a delayed discharge, she was released with the wrong equipment, which sadly resulted in her falling out of bed and sustaining a further injury. Ensuring patients are discharged in a safe and timely manner is key to continuing the department's significant progress in cutting waiting lists for treatment. So what steps is the Secretary of State taking to promote integrated working between services to support the discharge into the community of patients?
Thank you, Mr. Speaker. I'm extremely sorry to hear of that particular case. It's really important that we do support better and facilitate better discharge. That's why we're reforming the Better Care Fund, looking to integrate better health and social care services through our 10-year plan. And I'd be delighted to hear further from him about what we can do to improve in his area.
Thank you, Mr. Speaker. I have a constituent who has broken and rotting tooth, whose GP referred him to the local dental hospital, but he's been refused treatment as the dental hospital said the surgeon would only take a referral from a dentist, and something my constituent and many others in Somerset just don't have. So what does the Minister suggest he's to do to stop the pain?
Minister.
Well, I thank her for that question. She will know that we've now got a commitment to 700,000 more urgent dental appointments. For those who don't have an NHS dentist, they can call 111 and they will be prioritised. We are very clear, every ICB has a target on the 700,000, and if they're not hitting that target, we will want to know why.
Olivia Blake.
It is disappointing to hear from many of my constituents about difficulties accessing diagnosis, medication and other therapeutic inputs and the impact on their lives and livelihoods as a result. Whether it's children or adults, waits of 2, 5, 7 years are becoming the norm. What steps are the government taking to make sure that individuals can use their, and exercise their right to choose?
Minister.
I thank her, and I'd like to pay tribute to her for improving support for ADHD and recognising the valuable perspective that she brings through her own lived experience. This government inherited a broken NHS with too many people facing long waits for assessments. NHS England's ADHD task force is looking at how support for people with ADHD can be improved. I look forward to reading their report, and I had a very productive meeting with the director of that task force recently.
Given that the government is committed to 700,000 extra emergency dental appointments, but in the Midlands the UDA rate is just 83% and there's no additional funding for the ICBs, will the Minister give assurance to my Mid-Leicestershire constituents that they will fully deliver on this promise?
I will give him that assurance. We've been very clear that every ICB has a target. That was very transparently published, and we will be monitoring. I'm holding regular meetings with officials to check that every single ICB is on track to hit those targets, and if they're not on track to hit those targets, we will want to know why.
Marcus Campbell-Sabers.
Thank you, Mr. Speaker. Earlier this year, I met with the Cockermouth and Maryport Primary Care Network, who told me about the increasing challenge of supporting my constituents with their mental health. Has the Secretary of State considered relaxation of R's funding rules to allow mental health nurses to be employed wholly by a PCN and not need to be under the employment of the local mental health trust? This flexibility could help GP practices to intervene earlier and reduce referrals to secondary care quickly.
I thank him for that question. We have, in fact, relaxed the rules on Rs so that a mental health worker can be employed in the PCN. He's absolutely right that that's an important part of stepping from hospital to community. But, of course, there's more that we can do on that, and we continue to do whatever we can to ensure that mental health and GP surgeries are actively integrating.
Robin Swan.
Getting it right first time is a clinician-led programme which leads on improvement and transformation. Can the Secretary of State give reassurance that on any restructuring of NHS England, that getting it right first time, that programme will not just be continued, but it will be expanded and still available to the devolved administrations?
I'm absolutely willing to give him that commitment. I know that's something that he has worked on in his previous role in Northern Ireland. It is a programme that's delivering results. We want to see results. We want to take the best to the rest of the NHS and absolutely work together across the United Kingdom to make sure that all our residents across the United Kingdom benefit from the programme.
Gregor Poynton.
Thank you, Mr. Speaker. Lung cancer causes more deaths in Scotland than anywhere else in the UK. In England, though, early detection programmes are underway. By 2028, every patient is likely to gain access to screening. In Scotland, though, doctors tell me this programme is a distant dream. Does my right honourable friend agree that SNP is failing Scottish patients, failing Scottish healthcare professionals, and this UK Labour government is getting on with the task of fighting this deadly cancer?
Minister.
I would agree with my honourable friend. We are making great strides in terms of developing our cancer plans. We will be launching a national cancer plan later this year, and the targeted lung cancer screening programme has been particularly effective. The SNP have had a record settlement for Holyrood, and we expect them to deliver. And if they can't, then I'm quite sure that Anna Sawar and Jackie Bailey would be willing to take over.
Hello, John.
Thank you, Mr. Speaker. Yesterday's report from the Health and Social Care Committee is explicit that we cannot build an NHS fit for the future without effectively reforming social care. Back in January, the Secretary of State promised cross-party talks as well as Baroness Casey's commission. He cannot outsource political leadership to Baroness Casey. Political will is the sticking point with reform of social care. Will he show that leadership? Bring the parties together to find the solutions to unblock this crisis.
Secretary of State.
Mr Speaker, since we came into government, we've already taken action on social care, the investment that we put in, the biggest expansion of carers allowance, the home adaptations through the Disabled Facilities Grant. Now the Commission is up and running. There will be cross-party engagement, but it is an independent commission and for Baroness Casey to decide how to engage.
Catherine Atkins.
Last week, this Labour government announced the freezing of prescription charges, putting pounds back in the pockets of people in Derby. I visited pharmacies like the Little Over Pharmacy, which provides essential care and support for their communities. But the Conservatives underfunded pharmacies, and across England, over 750 closed between 2021 and 2024. What is the Minister doing to support community pharmacies so we don't lose these vital local services?
I thank her for that question. After years of neglect, this government has agreed with the sector a record uplift to £3.1 billion for 25-26 for this vitally important front door to our NHS. We're also supporting pharmacies to operate more efficiently, including enabling hub and spoke dispensing between all pharmacies later this year, and the legislation for that has been laid, I'm pleased to say. So what a contrast with the previous 14 years. Also very pleased to see that the NPA has withdrawn its view on taking collective action. So we're moving in the right direction, but still a lot more to do.
Alan Miller.
Thank you, Mr Speaker. Welcome today's announcement of the new money for GP surgeries, but in my constituency of Bristol and Woodstock, GPs tell me that they cannot get capital out of the ICB and that the Valuation Office consistently undervalues the cost of rents, making future GP building impossible. Will the Minister agree to meet with me and GPs from my constituency to understand this problem better?
Mr Speaker, thanks to the investment that we've announced, there will be the upgrade to those practices. I advise him to engage with his ICB. We're happy to receive representations if we can help. I would gently point out the investment is only possible thanks to the decisions made by the Chancellor, which he opposed.
Sonia Kumar.
Thank you, Mr Speaker. Ladies Walk NHS Health Centre in Sedgley is a vital hub for my constituents, providing essential services such as phlebotomy and diabetic foot care. However, due to the inaction of the Conservative Council, this much-needed community asset faces closure in 2026, leaving residents without access to critical care. Will my right honourable friend agree with me to discuss urgent steps to safeguard the future of the Ladies Walk Centre and ensure that Sedgley residents continue to receive the NHS services they rely on?
Well, I thank her for that question, and of course pay tribute to the fact that she is in fact a qualified physiotherapist, so she's absolutely right to be talking about the importance of community care. I would be happy to meet with her to discuss the important issue that she raises.
Jim Shine.
Speaker, what steps will be taken to support more community pharmacies that can offer a broad range of services to those in rural areas to ensure that those most isolated from busy towns still have access to these very important services? Thank you so much.
Well, thank you. And as I mentioned, we've got a record uplift to £3.1 billion. That's a 19% uplift of all the sectors across the NHS. It was actually pharmacy that got the best uplift from the 25-26 settlement. I'm very pleased to confirm. We've also maintained the Pharmacy Access Scheme that provides £19 million to support pharmacies in areas where there are fewer pharmacies, including in rural areas, as the Honourable Gentleman has mentioned.
John Trickett.
Well, on pharmacies, they play a key role in communities in rural areas like mine. But when the supply chain breaks down and the pharmacy isn't able to deliver the medicine, clearly it's deeply frustrating. Can the Minister tell us where we are now with the supply chain, and will he thank all of those heroic workers up and down the country doing their very best to deliver these medicines? And finally, will he thank particularly the 400 workers working for Superdrug in my constituency to try to make the supply chain work?
Minister. I'm pleased to congratulate and support the hard work of both the pharmacies at the front line and all the people that are involved in the department and elsewhere to make sure our supply chain is as resilient as possible. I know this is an issue that concerns many members of Parliament and many of our constituents. We are looking to do some sort of event in Parliament, Mr Speaker, to bring the information more closely to all members, but they do a great deal of work. We know it's an important issue, and I will update the House on other measures we're looking to take forward to make sure that them and their constituents are better informed.
Final question, Vicky Slade.
Last month I began receiving concerning emails from the employees of the NHS Trust in my constituency of Mid Dorset North Pool that their trusts were looking to create a subsidiary company to move staff across into, and they're really worried about their rights for the future. And I know how important it is to you that people have good employment rights. What steps is the Minister taking to ensure fair consultation with staff before creating these subsidiaries and prevent the creation of two-tier employment practices in the NHS where they don't have continuity of service?
Mr Speaker, while I understand the desirability of NHS trusts for such arrangements, this government is absolutely clear that staff must be in receipt of good NHS terms and conditions, must feel part of the NHS workforce, part of the NHS family, and I'd be happy to receive further representations from her.
Right, that completes questions. Let the front bench change over.